But Ajan, it's time right now for us to be heading into our Wisdom series segment. This is a segment that I fondly call Wisdom Therapy because we utilize certain wisdom skills to help us lead a developmentally oriented life. And for this, we do talk to the experts in the field of mindfulness and wisdom therapy. And one such expert is Dr. Shani Robins, who is a professor, a lecturer at Stanford, Fuller College, and several educational institutions. He's also a speaker at the American Psychological Association conventions that happen. He's an author of several scientific journals regarding wisdom therapy and mindfulness. And he is the person who brings on this segment for us right here. And we want to also mention that this particular segment is made possible by the kind support of pragnya.org. It's an organization that works with children on the autism spectrum. And if you'd like to get more information on this, you can go to pragnya.org or facebook.com/pragnya for autism. Let's go on and welcome Dr. Robbins. How are you doing today?
I'm doing great. Thank you. Good to be here.
Thank you so much for joining us, Dr. Robbins. We've been talking about wisdom skills, cognitive distortions, how to apply it in day to day life. I wanted to ask you, people say wisdom comes with age. I wanted to ask you, is there a certain age when one starts to practice the wisdom skills, or when one becomes more aware of the different aspects to life and how the cognitive distortions come into play? Could you talk a little bit about that?
Yeah, sure. Up until about 10, 15 years ago, we didn't have an answer to that question. Now we do, because there's been about 15 years of psychological science that have demonstrated through hundreds of studies, so it's not even dozens anymore, it's now hundreds of studies, and these are control group randomized studies, so gold standard research regarding how well kids and adolescents are able to learn skills like emotional intelligence, mindfulness, gratitude practices, and so on. And the short answer is absolutely they're learning it at every age. So there does not seem to be an age requirement to learn these skills. So one of the presentations I'm giving at the American Psychological Association next week is the title is "Can Kids Be Wise?" An intervention in schools consequence. And the short answer to that is yes. So there doesn't seem to be an age requirement for wisdom. It seems to be more of a practice requirement.
As an educator, as a psychologist yourself, how important is this to be taught in schools, Dr. Robbins?
Essential. And so it's a gross oversight that this hasn't been done until recently. There are now several programs across many schools called social emotional learning, SEL programs. And those are a good beginning because they do some emotional intelligence practice, they do some mindfulness on some campuses. But it's quite a small minority of schools that are doing this. But it's beginning to catch on. And so one of my goals actually is to bring some of these skill sets and trainings to schools and to do it in an experientially oriented way, in a way, so some programs for third or fourth graders are obviously going to be different than programs for sixth, seventh, or eighth graders or high school students. So clearly the application of these skills are going to be different depending on the age group, but you can have second graders meditating and you can have 12th graders meditating. And so there's some wonderful footage we have of video and wonderful outcome studies that demonstrate the amazing impact that what happens relative to a control group. How do students in third or fourth or fifth grades or in 10, 11, 12th grades, how do they do in terms of things like anger, anxiety, depression, disruptive behaviors in school? Just if you look at those four, statistically significant reductions in those kinds of emotions and behaviors: anxiety, anger, depression, and disruptive behaviors. And so teachers are always fighting to keep ruly classrooms, to keep kids engaged, to keep kids, to try to decrease their anger and anxiety. Anger and violence in schools has gone to epidemic proportions.
Right.
And now we obviously see just the horrific violence that occurs in schools. And so we now already know that there are methods and things we can incorporate into the curriculum that does not take a lot of time. We're talking about maybe 1 or 2 hours a week.
Right.
And that's not a huge investment to have dramatic improvements on mindfulness, emotional intelligence, empathy towards others, reduction of anger, anxiety, depression, and disruptive behaviors. The savings in time to any one teacher is probably an order of magnitude. It probably saves the teacher 10 hours for every hour you put into it in the curriculum.
Right.
And so it's now very promising. So from my point of view, any administrator, any principal, and any teacher that does not incorporate it into their classroom, it's almost negligence at this point.
Right. And Madhujan, Dr. Robbins also conducts wisdom workshops for our allies right here at Pragnya as well. And a lot of our allies, the age ranges were from like 7-year-olds to we had 16, 17-year-olds in
Yep.
our
Yeah.
in our workshop. And one thing that this was the Pragnya Ally workshop, and if you will probably be conducting more such workshops in the next few months. And if you'd like to be a part of it, definitely go to pragnya.org and click on the button which says Become an Ally, and you automatically will get access to these workshops that Dr. Robbins has been kind enough to conduct for our allies here. One thing that, as an organization, as an integral part of that organization, that I have noticed specifically is it helps build that empathy and compassion among our allies. Neurotypical children to be able to understand and relate to neurodiverse individuals. I mean, and there is no longer this, oh, you're weird, or you're a retard, or you're that kind of attitude, or, oh, I don't want to deal with somebody who's different from me. As opposed to now, let me see what I can do to get this person to work with me, is what we're seeing in a lot of our allies. So,
That's great.
yeah.
Yeah.
And I think it comes inherently to children because, a lot of times they're not as judging or judgmental. And I think it's extremely essential that we hone in on that and build on those skills right from a childhood. Really, one quick question before we go really quickly. Are there things that parents can do to incorporate very small, quick tips, if you can tell us what parents can do with their children at home to get them to be more empathetic or compassionate?
Well, the highest priority answer and the fastest answer, of course, is this: the parents themselves practice
Right.
and display by example what it's like to be empathic and mindful. And so just to preach about it and then do something differently and then yell at each other is not going to work. The kids will see through that. But if the parents can be kind to each other and empathic to each other's needs, and the kids are observing that, that's incredibly valuable observational learning. They'll learn by observing the parents. And so that, if I had to give one piece of advice, it would be that. And of course, the parents would benefit from that themselves in their relationship.
Yeah, and of course, Banjan, right now we're going to tell you practice what you have preached today.
Yeah, that's right.
And also practice what you preach.
And the same thing with the teachers. And by the way, I should probably throw this out there. If there are principals or teachers that are interested in me bringing this to their schools, or
Right.
if there are parents that are listening to this and they want me to bring this to their children's schools, they can talk to the teachers or the administrators and contact me, and I would be happy to talk to them about the possibility of bringing this program to their schools.
And of course, Banjan, you can reach him on the website, wisdomtherapy.com. Again, wisdomtherapy.com. Or if you chose to send us a message over here, we can connect you directly with his office and they can get back to you on this for sure. And once again, a wonderful session about how it's important for children to actually use these skills as well. And thank you so much, Dr. Robbins, for coming on and talking to us about this.
You're welcome. Thanks for having me.
We hope to talk to you more about these skills in the next segment.
Looking forward to it.
Thank you.